Welcome to this episode of Orthodontics in Summary. Today's podcast is looking at mouth breathing and pediatric obstructive sleep apnea. Today's podcast is a summary of two lectures that I heard this year at the International Orthodontic Symposium by the IOF. It was an excellently well held online and free symposium, and I've picked out some of the key lectures I really enjoyed. So these lectures are by Zhang and the giant Carlos Flores. Just to recap, the podcast is the opinion piece of myself and the Orthodontics in Summary team. It may not be 100% representative of the original lecture, but we try our best to ensure that it is. So back to the lecture. So what is the definition of obstructive sleep apnea? Well, it's a disruption in breathing during the process of sleep. Now, the frequency of how it occurs defines how severe it is. So by the American Academy of Sleep Medicine, if you have 5 episodes of apnea taking place within an hour, that is enough to classify it as mild sleep apnea. It goes all the way up to 10 and greater for severe cases of OSA. Now, for children or child, pediatric obstructive sleep apnea is for the count of 2 breaths to meet its definition. What's a greater topic is that of mouth breathing. Now that is defined as somebody who has an airflow of 25% going through the mouth as opposed to the nose. And what I really liked about Zhang He's lecture is that they explored, well, what is mouth breathing and its relationship both with obstructive sleep apnea as well as craniofacial structures. So Zhang He put forward the relationship or proposed relationship between mouth breathing and obstructive sleep apnea in children. It starts off with adenoid hypertrophy for patients. They end up having nasopharyngeal obstruction due to the position of the adenoid tissue, and this results in mouth breathing. As mouth breathing takes place, there's a change to function and form, and there is a clockwise rotation that takes place to the mandible, and the patient becomes a high-angle patient during their growth and development. As they enter adulthood, there is an oropharyngeal airway reduction, and obstructive sleep apnea embeds itself as an adult. Now that is a proposed pathway. What was interesting is Zhang He then explored the evidence behind this and found patients who were mouth breathers generally had a more retrusive maxilla and mandible, but also higher mandibular plane angle as well. Now the retrusion was relatively mild compared to controls of around 1.3 to 1.4 degrees for SNA and SMB, and that's Zhang's systematic review from 2020. However, the mandibular plane was significantly increased at a greater than 3.3 degrees relative to normal controls. But the question is that pathological? Does that relate of mouth breathers to obstructive sleep apnea and their craniofacial features? Well, Carlos Flores picked up a systematic review that he'd been involved with by Fungundes in 2022, and this was a really large study looking at patients diagnosed with obstructive sleep apnea and working back to their craniofacial features. And what they found was overall there was no craniofacial features specific to the population who had obstructive sleep apnea. Now, Carlos Flores was going one step further. We've been classically dividing up craniofacial features and medically related features, but he's bringing both of those together to explore both demographic features of patients, their lifestyles, their weight, but also looking at their sleep features and craniofacial features and seeing, well, what impact does orthodontic interventions have upon these patients? And I think it's exciting work that he's carrying out in this particular field. What about when it comes to having treatments for these patients? Well, things which are mandibular advancing or expanding seem to be the direction of travel, but how effective are they? Simple appliances like the modified Clark twin block reduce patients' obstructive sleep apnea index from 14, which is a severe case, down to 4, which is less than mild. That's Zhang's study from 2012. But how sustained are those features long term? And these questions still remain unanswered. When it comes to expansion taking place, yes, mini-screw assisted expansion or conventional rapid maxillary expansion can be carried out and significantly increase the airway space which is available. But when these patients were followed up longer term, it seemed that volumetric increase reduced with time and became ultimately non-significant as 6 months passed and so forth. So that's Zhao's study from 2021. There's also tonsillectomy, when clinically indicated from a medical perspective, can result in an increase when it comes to the airway space. What's interesting is that the tonsillectomy has no bearing on patients' mouth breathing, even if the obstructive sleep apnea is resolved for these pediatric patients. And I really enjoyed Flores' reflection on this topic and stated that it's a complex 3D structure, and simply changing one parameter or having one treatment does not resolve the entirety of the problem. And the real challenge he demarcated as was the fluid dynamics. How does air actually transfer itself from one place to another within this complex structure, which can have multiple deficiencies or multiple components which affect the fluid dynamics? What's interesting from these lectures, we hear that mouth breathing does seem to have an impact upon craniofacial growth, albeit relatively small. But actually obstructive sleep apnea at this point in time, our understanding does not indicate that it does. So there's a disconnect between mouth breathing and the actual pathology of obstructive sleep apnea taking place. Both speakers described the AAO's white paper from 2019, which essentially described the role of orthodontics in the process of obstructive sleep apnea, being familiar with both the condition and the main role is of screening for patients with the disease. If that's present, then refer onwards to either ENT or to physician when it came to looking at their risk factors and pathology which was present. Just a quick update from me. Bjorn Ludwig was our guest host for Orthodontics in Interview. He took charge of the microphone and was really well received as an episode, especially by me as I got the week off. As always, please do subscribe and look forward to the next episode.